My name is Jaslyn. We're from the local newspaper to interview a physical therapist today.
And hi, my name is Autumn. Please introduce yourself.
I'm Paige.
Okay, so as a physical therapist, can you describe what your job is?
I see patients individually and I examine them. I develop treatment plans for them and basically help them with their condition to have a better health and well-being and to help rehabilitate their injuries.
How much is a typical salary for a PT?
It starts out at $85,000, but it can definitely go up from there.
What would you say is like the most difficult part of your job?
Probably making a treatment plan for the patient that takes into account their emotional and physical well-being and their conditions considered, because they all have very different lives and very different conditions, and there's a lot of things that I have to remember.
Okay, what would be the most rewarding part of your job?
Being able to improve their lives and see that on their faces when they walk out every day after our session, and be able to help them with their injuries.
What are the benefits of being a PT?
You could definitely become an entrepreneur and start your own practice, be your own boss. There is a high demand in the profession, and you can choose where you work, such as for elders and young people. It's a very flexible job.
Okay, what are some of the common health conditions that you treat as a PT?
Cardiopulmonary diseases such as cystic fibrosis, musculoskeletal conditions that consist of back pain and things like that, and neurological conditions that happen after stroke. Stroke is a very common condition that I see. And then also pediatrics and sports injuries that deal with like ACL injuries and those bigger injuries that occupational therapists can't do.
What is the percent job growth?
36%. That was reported in 2014 to end up growing until 2024, which is very high compared to a lot of other professions.
So what are the most common degrees that PTs can get?
The most common bachelor degrees are exercise science, human biology, and kinesiology. After achieving your bachelor degree, you will have to complete a 4-year MD program.
What other education requirements would you need, like GPA?
You have to at least have a 3.2 GPA. Most people that I work with have a 4.0. You have to also do 300 service hours and take classes such as anatomy and physiology, chemistry and biology, kinesiology, of course, physics and statistics, and social sciences.
What would be the recertification process?
You have to have 10 years done for certification and 3 years before expiration. I have done 200 hours of patient care. That happened with at least like the last 3 years. For the process of my recertification, I have to register for a date, submit a professional development portfolio, and then I have to have evidence of successful APTA accredited clinical residency. And I pay $650 for recertification, but the first time you take the test, you have to pay $910.
So the interview part is over. Now it's time to see your daily routines as a PT.
Okay, so unfortunately we can't film a whole session due to patient privacy, but as my day would go, I have about 4 patients such as Maggie Lou. Maggie Lou had a stroke about 6 months ago. She's come very far. She's learned to walk again. She started out in a wheelchair, and now we are working past her cane. As you see, she doesn't have it right now, which is very good, which means that I'm doing my job well. I've got 4 other patients coming in today for other conditions, but I will ask her how she is feeling from a pain scale of 1 to 10, as so I would do with my other patients, and base the rest of the session off of how she's doing and our conversation that we're about to have.
Thank you for your time today, for letting us interview you. Good luck with your patients and the rest of your day.
Thank you. It was nice having you and talking about my profession. Bye. All right, Maggie Lou.